Okay, let's jump right in. We usually think about fighting cancer with things from the outside, right? Chemotherapy, radiation. But what if one of the most powerful weapons was already inside our bodies? Today, we're looking at how AI is helping us unlock our own immune system to open up a whole new front in the fight against breast cancer. To really get why this is such a big deal, you have to understand the scale of the problem. That number right there, 2.3 million. That's how many new cases of breast cancer are diagnosed every single year. It's the most common cancer in women around the globe and a leading cause of death. So any breakthrough, any step forward is just a massive win for global health. So where does our immune system fit into all this? Well, it all goes down in a place called the tumor microenvironment, or TME for short. There's this amazing analogy for it that goes all the way back to 1889. A scientist named Stephen Paget came up with this seed and soil idea. He said a cancer cell, the seed, can only grow if the soil around it is just right. The TME, that's the soil. It's a complex, living battlefield that can either help the tumor grow or help fight it off. And on that battlefield, we have our most important defenders. Tumor-infiltrating lymphocytes, or TILs. You can literally think of them as the body's own soldiers. These are immune cells that have spotted the enemy, left the bloodstream, and marched right into the tumor's neighborhood to launch an attack. And it turns out, just counting how many of these soldiers are on the front lines can tell us a ton about how the patient's battle is going. So here's our game plan. First, we'll explore that hidden battlefield inside the tumor. Then we'll get into the big problem pathologists face when they try to count these immune soldiers. After that, we'll see how an AI pathologist is trained for the job, how we can actually build trust in that AI, and finally, what all this means for the future of treatment. All right, let's start with that hidden battlefield. Why is getting an accurate head count of this immune army so critical? Well, as it turns out, it's one of the best predictors we have of a patient's outcome. The bottom line is this. TILs are unbelievably powerful biomarkers. This is especially true for some of the most aggressive forms of the disease, like triple-negative and H2-positive breast cancer. The science is clear. The more TILs you have, the better you respond to treatment. And get this, one huge study found that for every 10% increase in these immune soldiers, the risk of death can drop by as much as 16%. That is incredible. For some patients with really high counts, their outlook is so good they might not even need follow-up chemo. This isn't just an abstract number. It's a direct measure of the body's own power to fight back. Which brings us to a huge problem. If counting these cells is such a game changer, how are we doing it? Well, for decades, the answer has been a human pathologist looking through a microscope. And this is the pathologist's dilemma. Right now, the standard method involves a pathologist looking at a slice of tumor tissue and, well, estimating the density of these immune cells. They basically eyeball it. You can probably see the issue here. The process is slow, it's incredibly subjective, and it's plagued by what scientists call inter-observer variability. That's just a fancy way of saying two of the best experts in the world can look at the exact same slide and come up with two different numbers. It's not a knock on their skill, it's a flaw in the method itself. And this timeline just shows you what an uphill battle it's been to make this a standard practice. Back in 2012, a working group got together to try and standardize everything. But the scientific community was skeptical. In 2015, the idea got rejected flat out. By 2017, still less than a third of experts were on board, but the evidence just kept piling up. By 2019, look at that jump. Support shot up to 66%. That growing momentum paved the way for a huge shift, and in 2023, using AI to automate this was finally recognized as a standard of care. It took over a decade to get here. So the limits of the human eye really demanded a new solution. And if the human eye isn't quite up to the task, the next logical step is to train a digital one. This is where we start training an AI pathologist. And when you put the two methods side by side, the advantages are just night and day. Manual assessment is subjective and varies from person to person. AI? It's objective and consistent. It gives you the same answer every single time. A human pathologist is slow and can get tired. The AI is lightning fast and can scale up to analyze thousands of slides. And maybe the most important difference, a person might miss subtle details or only look at a small area. The AI performs a totally comprehensive, exhaustive analysis of the entire slide. The result is a highly reproducible measurement you can actually count on. Okay, but that brings up a really important question. How can we be sure the AI is actually right? I mean, you can't just unleash a new algorithm on patient care. You have to build trust, and that comes from a super rigorous, totally transparent path to the clinic. You can think of this process as a brutal obstacle course for the algorithm, an AI validation gauntlet. It all starts with gathering tons of data, thousands of high-res images. Then comes the most critical part, creating the answer key. This is where expert pathologists painstakingly mark out all the immune cells on those images to create what's called a ground truth dataset. Then the AI studies that data, learning to see what the experts see. But the real test is when you validate it on brand new, unseen images from totally different hospitals. Only after it passes all those tests with flying colors can it be considered for approval by bodies like the FDA. So, what do those results look like? This is where the trust really gets built. This table shows the correlation, how well they agree, between the manual counts from human experts and the automated counts from AI. Now, that R value is what you want to look at. A score of 1 would be a perfect match. And as you can see across multiple studies, the correlation is consistently strong. Some recent research from 2023 shows values over 0.97. This is the hard data that proves the AI can reproduce what human experts agree on with amazing accuracy. Okay, so we have a tool that's more accurate, more reliable, and more objective. But what does that mean for the person at the very center of all of this, the patient? This is where we see how AI can truly change lives. The clinical impact here is huge. First, it kicks the door wide open for precision immunotherapy. By getting an accurate TILs count, doctors can finally identify exactly which patients will benefit from powerful new drugs that supercharge the immune system. This leads us right into an era of true personalized medicine, where treatments are tailored to you, not just your diagnosis. For patients and their families, it means a better prognosis, a much more reliable prediction of what's to come. And finally, on a practical level, it leads to a vastly improved workflow in labs, freeing up brilliant pathologists to focus on the most complex, challenging cases. This quote from the research really just says it all. The ultimate goal is to optimize treatment. We want to give every single patient exactly the right amount of therapy. No more, no less, avoiding the risks of both overtreating and undertreating. And by doing that, we can absolutely increase the survival of patients with breast cancer. So we've seen how AI can help us read the body's own battle plan, turning what was once a subjective art into an objective science. It's a true game changer. And it really makes you wonder, as AI helps us turn the tide in this fight, what's the next frontier in medicine it's going to help us conquer?